We set out in 2003 with a mission to eliminate the African American prostate cancer disparity. A lot of people may not realize that this is the largest disparity for any type of cancer. When black men are diagnosed at a rate 60% higher than all other men, and die at a rate 150% higher. That's 2.5 times that of other men. Those are alarming numbers when you look at them and consider what they mean. It means a lot of unnecessary death. So our mission is to eliminate this disparity. And we believe that the best way to do this is through knowledge. And that knowledge itself is the best defense against prostate cancer. Prostate cancer is not a monolithic disease. It's a unique disease to different men. So men have to really understand their disease. They have to understand disease overall, but then they have to understand their condition. And when you talk about knowledge, we believe that Black America should be the most knowledgeable and engaged. If you hit the hardest, then you have to have the best defense. And so that's what we're trying to do at PHEN. And how are we doing this? We're doing it through an initiative that we announced at our summit in 2006. That was our second summit. And it's called the Rally Against Prostate Cancer. And there are a number of initiatives within this Rally Against Prostate Cancer. We started out by realizing that to win this fight, we had to have soldiers. So we went out and recruited survivors, men who faced the disease, and we created a national survivor network, which is integral to all the things that we do. We have monthly meetings at the Dana-Farber Cancer Institute. And I can say, and I hope we have friends from Dana-Farber who are tuned in this morning, that the Dana-Farber Cancer Institute in Boston, and I serve on the trustee board, but they really committed to PHEN, and they committed to our mission right off at the beginning. We were founded in 2003. We began holding our meetings at Dana-Farber in 2003. We began webcasting segments of those meetings live in 2011. The other initiative is our annual African American Prostate Cancer Disparity Summit. You're here. That's what this is about. You can see what we're doing at the summit. We're bringing leaders together, policymakers, industry, and because we need to discuss this together. Then we kicked off in 2009 our annual Father's Day rally, and that rally is taken on to be our most aggressive and grassroots initiative. 3 years ago, we began our educational symposiums. 2 years ago, and we'll talk about those later. We have online resources, including PHEN Television, e-newsletter, and we began this year at another initiative we call Your Prostate Health Minute. And this is an initiative with radio stations across the country. If you look at our focus areas, when we started out, we said, where are Black people? And we looked at a map, and we looked at where the highest concentration of African American people are in this country. And we decided to focus on these areas, and you can see them there. And one of the things that we realized is that most of these areas have a member of the Congressional Black Caucus. So one of the things that we talked about last evening at our reception was that after our very first summit in 2005, we had 18 members of the Congressional Black Caucus join us in recording 1-minute awareness messages. You heard some of those messages last evening at the reception. So the CBC members jumped on with us in 2005, right after that very first summit. And since that time, this summit has become a part of their annual legislative conference. So mobilizing and educating Black America in the fight against prostate cancer. That's our effort here, and that's where we are making some strides. Now let's talk about some of the highlights. First, I want to go back and talk about our Father's Day rally and our church partners. we realized that in order to have a presence in all of those cities that I just showed you, that we had to rely upon a volunteer army of survivors, but we needed really a presence in each one of these cities. So we went out and talked to different churches and asked them to join us in the fight against prostate cancer. And we now have 400 church partners reaching around the country. We reach a million plus people through these churches and medias within these cities. And after our Father's Day rally in June of this year, we did a survey. We went back to the churches and asked them, you know, tell us whether you were successful. How is this program within your church? And 95% of the churches reported that the Father's Day rally was successful within their church. 94% of the survivors and loved ones were pleased with the recognition. When we began the Father's Day rally, it was really, we asked churches to do what they do, and that is to pray for prostate cancer survivors, those men who are facing this disease, and really include them in their service on Father's Day. And not a special program, but within their service on Father's Day. So that recognition, as the churches said success, 94% of the survivors and loved ones are pleased with this recognition. And 98% indicated that they will participate in our 2015 Father's Day rally. In addition, 91% of churches want to participate in additional activities. So when I get that type of feedback from my partners, what it tells me is that, number one, we're having some success. Number two, we can do a whole lot more because people are on board with us. And so when we looked at these numbers, we were very, very excited. In 2013, we tried with our church partners. We said, let's take this another step and have a symposium at 7 sites in 6 states. And we did that with some success. In 2014, we went to 14 churches in 11 states. And in 2015, our plans are to go to 30 symposium sites across the country. And we're going to do a couple of things here that we're going to change. Number one, we're going to expand that period from just the day before Father's Day, and we're going to look at a period between April and June so that we can include all of these symposia. In addition, we have been relying on specific churches to host these symposiums, which we will continue to do, but we're going to make these more citywide events. And we're going to invite other partners to join us. So it will be, we're looking to have a team of churches who will be our hosts in these cities. We're certainly going to bring in other partners, and you will hear from some of those partners today. And we're going to really integrate our political leaders, policymakers within each of these cities and each of these states. So we're going to make these big events. We've proven over the last 2 years that these work. They do attract people. We're getting our message out. So we're planning to step on the gas in 2015 to do much more. When we looked at the outcomes for this past 2014, we found that 8% of all the attendees were wives or caregivers. And we put an emphasis on that this year. We found that 78% learned of the symposia through their churches. So that is proven to be successful. Our church partners are helping us get the word out and helping us recruit people to the symposium. 96% of the attendees were satisfied with the topics, the speakers, and the organization. And 98% plan to attend or recommend someone to attend in 2015. Like the Father's Day rally, the symposia survey results tell us that we're on the cusp of something big that we really want to take advantage of. Now, I will talk about our monthly educational webcasts. As I mentioned, we began hosting our monthly meetings at the Dana-Farber Cancer Institute in 2003. And we look at these as our continuing education program. We focus on a specific topic with expert speakers every month. You heard some great speakers yesterday. We do this each month. We bring a speaker to focus on a topic each month. And we're reaching out to our church partners with opportunities for these churches to assemble audience and begin what we call our webcast fellowships. So we want to try to encourage them to build support groups within their church community. People are watching the webcast individually. We love to bring them together. The other thing that we plan to do in 2015 is to look at a prostate cancer awareness message each month. You know, September is Prostate Cancer Awareness Month. It does not get the attention that breast cancer does. We have a lot of work to do there, and that's on us men and our wives and our loved ones. And I call on my wife to help me there, and she does. But what we want to do is to make every month in Black America Prostate Cancer Awareness Month. So we're going to reach out with these topics to let our partners, to let our Survivor Network, and let the communities know what we're educating our communities about that month. So we'll have a Prostate Cancer Awareness Month for January message, February message, and so on. And again, this is to build more activity to make sure that we're the most educated of all of the population. Now, I spoke to you about the PHEN Survivor Network. And I can't say enough about the Survivor Network. When we recruited the survivors to work with us, we've gotten such commitment. They are the key to what we are able to do throughout the country. We could not afford these players. We could not afford this support. They do it because they're committed to the cause that I've just spoke to you about. We have a Survivor Network that's growing. They lead and support ongoing education efforts within their communities. During this month of September, Prostate Cancer Awareness Month, we had members all across the country very active with outreach campaigns. And we provide them with information, we provide them with guidance, but we get calls from them saying that we are participating in this event, and they're just doing an outstanding job. So when I look at our education outreach strategies, we want to continue increasing prostate cancer visibility. We are going to expand our church partnerships. We're going to broaden partnership with community organizations, and we're going to expand our medical specialist volunteer faculty. And that's something that maybe I didn't let you know, that we don't have a paid faculty. We rely upon the support of some fantastic people who, again, are committed to our cause. And we had 33 of these medical specialists support us at the Symposia around the country in 2014. And we're growing this group of faculty, and I can't say enough about them and the work that they do on behalf of beating prostate cancer in Black America. Another thing that we began this year is to increase our focus on women and caregivers. We know when it comes to health, women just do it better than we do. That's just a fact of life. You can't get around that. I think, you know, if I look at my home, my wife, she is the health manager for our entire family, for me and for our children and grandchildren. And when you think about men facing a disease where they need support, psychological support, loving support, all type of support, the women are important. The wives are the caregivers. So we're going to increase our focus there. We began it some this year, but we're going to step on the gas in that area as well. In closing my remarks, what I would like to say is that we are winning. When you look at over the 10 years that PHEN has been hosting these summits, the mortality rate for prostate cancer has declined by 40% in African American men. Declined by 40%. Think about that. That's a win. And we have a summary of the statistic that shows those numbers. And we've had a decline overall for African American men, for white men, for all men. What we have to do more of is to continue that decline, but we need to accelerate our decline to close that disparity, to close that gap. So we're winning. With the things that I've just outlined, we plan to do more PHEN. We do it with the support of our survivors, we do it with the support of our church partners, and we do it with the support of our sponsors and industry partners. And you know, I can't say enough about our industry partners. They help make this summit a reality. When we talk about our Father's Day rally, they are there with us. So it is a team effort. And this team is growing, and this team is winning. And I thank you all for your support. And if anyone has any questions about any of our strategies, I will answer those questions for you. Very good. Well then, thank you.